That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr Alkhayyat, and joining us today for coffee is Dr Khaled Alazemi.
Hello, hi.
So, now before we get into our discussion and topic of the day, which is living and studying and working abroad in the UK as a medic, I just want to talk a little bit about our coffee. What are we drinking today? So, we have a brand new setup here at the Doctor's Brew. We're brewing with a mocha master now, and today's coffee is from HMC. We are drinking the Taro Ethiopia blend. Let's see the notes here. It's Earl Grey, hazelnut, blood orange. Now, a crime that I'm committing against most coffee drinkers, I like to put a little bit of milk with my coffee. And it's delicious. I love it. Stay caffeinated, everybody. Dr. Khalid, what do you think?
It's actually a really good coffee, to be honest.
There we go. HMC, you're doing a great job. So, just to know, going forward, I'm going to refer to Dr. Khaled Alazemi as Khalid because it feels awkward to me because we've been studying together for years. Khalid was with me in Manchester. He studied there. We were there for how many years? 6 years?
Yes, 6 years.
6 years. And, decent portion, if not majority, of Kuwaiti medical students studying abroad are in the UK. Like our family medicine board in Kuwait has recently been recognized by the Royal College of GPs in the UK. There's a strong link between Kuwait and the UK for medicine. That's undeniable.
Yeah.
But many medical students and young doctors, myself included, are surprised for better or for worse for what awaits them there. Which is why I wanted to bring Khalid along with us, because one thing that was unique in his experience in Manchester was that he was placed in Preston, which was a farther away city, right?
Yeah, it was good, quite far. It was around an hour away from Manchester.
1 hour away, yeah. So it's not like you could just live there, and still commute back and forth to Manchester. So I think he has a unique perspective as to his life in the UK. And I think this is going to be extremely beneficial for young medical students and doctors who are going to go and work there.
Yeah, I hope actually give some perspective into both living in a big city and a smaller one.
Now, before we really delve into things, let's ease in here. Did you like living in the UK? That pause.
Yeah, in general, it was a good experience. 6 years, so obviously you had some good and bad times there.
But on the whole, would you say that you felt that place was home for you or no?
Not really, to be honest. Home is home. You can't have another place that feels like home. You still feel like you don't belong there, to be honest.
I have to agree. For me, it never truly was the smoothest of landings and transitions there,
Yeah.
But overall, would you say that you regret going?
No, not really. Actually, if I look at the bigger picture, it's a positive experience there. I got a lot out of it.
But do you think it's for everybody?
I don't think so, to be honest. I don't think so. You have to have a certain type of personality or characteristics.
You think so?
Yeah, I don't think it's for everyone.
Yeah, I think that's one thing, a lot of people think that everybody should be going to study abroad, and I really don't think so either.
No, I don't think so.
So the first thing that I really want to get into with you here is about geographical and cultural issues that you faced. First, let's delve into Preston.
Yeah.
The reality is that when you go to the UK to study, you're not necessarily based in the place that you're going to be at, right?
Yeah.
Can you talk to us a little bit about that?
So as you mentioned, I'm a University of Manchester graduate. So when I was accepted in the scholarship, I chose to go to Manchester as a big city and a city that's known for it to be a good city for students and especially Kuwait students. The population is big there. And then, the program is designed into 2 preclinical years and then 3 clinical years where you get placed in a hospital. My first 3 years were in Manchester. And then you get randomly allocated in one of the 4 hospitals. 3 of them are in Manchester or near Manchester. You can live in Manchester. And then my hospital was an hour away. And you get the result of where you're allocated, I think, by first year Yeah, first year. So it was actually a bit of a shock to me that I chose to go to Manchester, but now I have to move out of Manchester and relocate in Preston, it's actually a new city. It was named a city in 2012. Before that, it was a town.
Really?
Yeah.
Okay.
So you can imagine.
You know, I actually made fun of a few of my British friends because the concept of a town, we don't have those in Kuwait. Like, what's a town?
Well, I don't have the definition, but it's somewhere you don't want to live. So
I mean, so that's a good point about how you you end up being placed in a place that is not necessarily where you were expecting. How was the shock for you?
well, obviously, the process of choosing the city from when you were in Kuwait, you obviously choose the city because you want to go there, study there. You know the city, you're familiar with the people there, your comfort zone. Before going there, I asked a lot of people, where should I go? I was honestly between Nottingham and Manchester, but I ended up in Manchester because I knew a couple of friends there. So you go there because you want to be around your friends, and then suddenly you get moved away.
Thrown in a random place.
Yeah.
Now, for me, I remember always being shocked and confused as to how they can be able to throw us there because, correct me if I'm wrong, this is not communicated to us Kuwaiti students in terms of the Betha, right?
No. You'll never hear about it until you're there. Actually, like it's a sudden, it's shock.
Now, do you think this is something that should continue to be hidden from people?
No, I don't think so. Like you need to be ready. You need to be ready and realize that you might not live there. You might be moved away from the city you chose to go to, because it will help you in taking decisions.
So, okay, imagine me right now. I'm a younger cousin of yours.
Yeah.
I'm about to go study in the UK.
Yeah.
And I just told you that I got accepted into Manchester.
Yeah.
What are you going to warn me geographically for me to be, like, what should I expect going in there?
In Manchester. Manchester itself, as you know, Aziz, is a multicultural place, so you don't actually feel like you're an outcast or you don't belong into the community. There is a group of, like, a huge community of Asians and a mixed community, so you don't feel like you're an outcast. But Preston, not many, like, people around in general. Like, it's a small, I still call it a town. You don't have much to do, so I need my cousin to understand that you might be relocated to somewhere else, and be ready with any consequences, like, or any things that can come across you, because it's a 6 years journey. You can't be like midway, no, I don't want to continue.
Yeah, and okay, so you got placed in Preston.
Yeah.
Moving around though, was it by bus, taxi?
Well, Preston is quite small, so most of the time we'd walk around, and then for every day to the hospital, I used to take the bus, which is around 25 minutes.
25 minutes on the bus?
Yeah, 25 minutes with all the students, because schools start with us at the same time as us, so you'll have students with you, and the environment is not the best environment in the bus.
See, for me, I eventually found the need to drive there because I was in Salford, which again is out of Manchester, but it's only about 15 minutes away. So it's like, okay, kind of still within the same geographical region. But the reason why I needed to drive was, how do I get there? If for me to get there, I needed to either have a ride with a friend or I'd have to take a specific bus, which might be late. I had to take maybe 2 of them. And then the next part is the placements. For Preston, were your placements sometimes out of Preston?
No, we had 2 hospitals, mainly 2. The Preston Royal Hospital, which is most of our placements are in, and our rotations. And then we have another one, it's called Chorley Hospital, which is the opposite direction of Preston. So it's 25 minutes away from where I live, my apartment, but 50 minutes away from the hospital, the main hospital.
So then how did you get there?
I lived in the middle, so so I still use the bus for both of them. So.
But would you say that you need to drive?
Well, to be honest, depends. Like, why do you want to drive? Like, is it just for the hospital itself? I don't think it's worth it. But if you want to commute, go to visit your friends in other cities, because as you know, sometimes trains, like you have your last train is at 10 or whatever.
Exactly.
Yeah. If you want to stay longer times with your friends, you need to have a car.
And well, not you. I mean, was anybody able to live in Manchester and commute to Preston?
Well, yeah, your close friend, you know that. In the
All right.
final year, he lived there in Manchester and
Yeah.
was commuting every day to Preston. But it really affects your attendance. Like you need to be there by 8 or 8:30. I think you can't sleep. You can't get enough sleep. You have to wake up earlier, and then you need to commute back. And I don't think it's worth the hassle.
It's a hassle, and you know,
Yeah.
another thing, it's a financial burden.
Yes, it is indeed. Especially also with parking. I don't know about the issue with parking, but what I see from the hospital, the other students or the British students are struggling with parking.
Mhm.
So why would I overthink that before in the morning if will I find the parking or not? Just use the bus and then.
Exactly.
Yeah.
Now, bearing in mind this geographical shock, do you think that if you knew this before going to Manchester, this would have affected your decision?
Not necessarily, but just in general, I didn't want to go to the UK. So in general, the UK, I feel like I had to go to the UK. I didn't have a choice because I wanted to go to the US, and I did 3 SAT exams to get to the US. And then my final year during high school, I chose to go to the UK.
That's
So in
interesting
general,
you're saying this because this was exactly my experience.
yeah. So in general, going to the UK wasn't my first choice. So I was ready for any. You know, when you go there with a really bad mindset, bad thoughts, the worst. You already expected the worst, so it didn't matter much to me.
I get you. But for me, I think definitely if I knew about the geographical location issue, this would have had an impact on where I go. Especially because the UK is not exactly like the US. It's,
Yeah.
how can I put it? There's a lot more rural areas that you're going to be exposed to.
Yeah.
How did you feel in those? Because Preston, it's not rural, but I mean, for a Kuwaiti student like us,
Yeah, it
going
is.
there.
For us, yeah, it is.
Yeah.
Well, as you mentioned, it's different than the US. The people, like, I feel like, to be honest, like, not to offend anyone, but I do feel like Americans are way more friendlier. Yeah, they're way more friendlier. It's easier to talk to.
So I'm going to make this a reel. Dr Khaled Alazemi thinks Americans are friendlier. We're going to cut this and just put it on a loop. And then let's see if you can get a visa to the States.
Okay. Yeah.
I see the sweat.
Yeah. I think they're friendlier. They're easier to talk to. But when it comes to like many Kuwaiti students are afraid of going to abroad is racism or something like that, or will they be looked at? How will they be viewed? I don't think I personally didn't feel like I was an outcast or someone didn't like me because of my skin color or my accent or whatever. I feel like they were very friendly, like in general, British people.
And I have to say, I think as a whole, the fact that we have a very strong Arab and even stronger Kuwaiti community there, that definitely does make a difference.
It does. I don't know about you, Aziz, but for me, most of my time, I interacted with the Arabs or Kuwaitis. It's not that I don't like interacting with the British, but we don't have like much in common, to be honest. Like we're living different lives, different cultures, different. So my comfort zone was being around Kuwaitis, and just to add on that, to be around Kuwaitis who are not medics. I think medics. I think being around medics is stressful. They cause you anxiety. They're preparing for exams early, very early for the exam, and like the whole.
Well, it depends who you ask.
Well, that's the truth. You know what I mean? Like, I don't like thinking about studying. So, I like to be around people who encourage me not to study, instead of encourage me to study. That's the
really.
Yeah.
Okay. Interesting. Yeah. But okay, let me challenge you on this point though, culturally. So you mentioned that a lot of your interactions and friends, which the high majority of us Kuwaiti students, this was our experience as well, were Kuwaitis or Arabs, correct?
Yeah.
Now, do you think to an extent this is depriving you of the experience of studying abroad? Because one of the benefits of us Kuwaiti students going abroad and studying there is that it gives us an exposure to foreign cultures, which aids in our medical practice.
Yeah,
correct? Yeah. So would you say that this dampened that experience?
Well, not really. Like my goal from studying in the UK is to be a good doctor. I didn't go there to take from the culture or so it doesn't matter to me. I was there to become a good doctor, and my literally I can do whatever I want. Just the end result is to be a good doctor. So the people I interact with, I interact with people to become people I'm comfortable with. Kuwaiti students are the students I'm comfortable with. It's just because we don't have anything in common with the British students.
Yeah, they were. I have to say, as a whole, they were very welcoming and nice.
They were. Yeah, they were. They were, and they had good events and activities they do, and they'd invite us. But in general, like also, I don't want to speak English all day, so yeah.
Now, on culturally though, did you have any issues in practicing there?
Practicing there.
Yeah,
as
like
in rotations.
Yeah, I mean, technically you weren't a doctor there.
Yeah.
But we were very much part of the medical team, and we had clinical rotations there.
Yeah. Well, to be honest, I think fear of any medical student, whether in Kuwait or in the UK, is not to feel welcomed by patients. Like,
definitely.
Yeah, you don't want to go talk to the patient and be like, I'm a medical student, and they'll be like, no, I don't want to waste my time. I don't want to talk to you. I didn't face that at all in the UK. In all 6 years, I felt welcomed, and everyone was willing to talk and was very helpful. The only thing I struggle sometimes with is, when you're in Preston, sometimes you hear some slang words that I've never heard of before.
Yes.
Yeah. After all, like it's a silly word, but I graduated from an American school, so the word fortnight is new to me. So I remember I was talking to a patient, he's like, Fortnite. I kept going on, Fortnite, and then I was like, what's wrong with this guy? He's playing Fortnite at 70-year-old. And then what I realized is he meant 2 weeks ago.
Yeah.
So it's a new word to me.
What about stones?
Yeah, so it's also the word knackered. I remember one of the students was like, you look knackered today. I was like, what did he mean by knackered? But he means like you're tired today. So it's just those words. Sometimes you don't understand them.
I'll tell you on that note. So you know how a lot of the British people, they say you're right to mean how are you?
Yeah.
Yeah. So the first time that I ever heard that, someone looked at me and he goes, you're right. And I just looked at him, I'm like, is he saying am I okay? I thought something was wrong with me.
Yeah.
I thought I was genuinely concerned.
Yeah, exactly. Especially when you go to order something, they don't ask you what do you want. You're like, you all right? Okay. I'm all right, but I want to order now. So especially when you go order for a coffee or something.
My poor mother, when she would come visit me in the UK, she'd actually take me around to translate for her when people would speak to her.
Yeah.
Because she couldn't understand the
accent. Like at the beginning, you don't understand anything.
No, you don't.
Yeah.
It definitely takes some time.
Yeah, it does, definitely.
But do you think that there was, especially for students who maybe don't speak as well of English, do you think that there was an issue communication-wise in the hospital?
Well, if you look at the people like who graduated from University of Manchester, most of us are students who came from American schools or British schools. So I think in general, especially in medicine, you need to have a really good, you need to be able to speak English really good. Like,
yeah, even in Kuwait.
Yeah. Like, but in Kuwait, if you take histories, like you'll be talking in Arabic. But there, your history, your today life is in English. You need to be a good English speaker. Like, I truly believe it affects you. It affects you a lot, especially in OSCEs, because you will stand out between all the British students. Someone who couldn't get the right questions or right answers from the patients, especially if you're talking about things that need a lot of talking, like ethics stations. You need to be able to ask the right questions without offending the patient.
And do you know anyone who struggled with this?
Well, I do know people that struggled with this, especially some of them, when they do struggle, they prepare what to say in the station. But in reality, you know that in OSCEs you can't prepare. You don't know what question the patient will ask you. So I think you do struggle, especially it's mostly with the sensitive topics. Some things we say are not offensive to us, but when you translate them directly into English, it might sound offensive.
Did you struggle coming back and switching from English in the hospital to Arabic?
No, I honestly struggled at first with English in OSCE stations.
Oh, so not the reverse.
Yeah,
back.
I struggled with showing like in OSCE stations, they ask you to show empathy a lot.
Mm.
I struggle to show empathy in OSCE stations.
So you struggle to show empathy.
Yeah.
Okay.
Well,
This is a good sign of being a doctor.
well, I struggle to show empathy in English.
Okay,
In English,
interesting.
because it's different. Like
Give
in
me an
Arabic,
example.
like أجر وعافية أمورك طيبة إن
صح.
شاء الله. You can say different things.
Hey.
But in English, you don't know who you're speaking to. You can't bring up God. You can't bring, like it's showing empathy, and you can't just say I'm sorry that you're going through this. I'm sorry. Okay, well, change.
Change the term.
Yeah, change it. Yeah, like it's just showing empathy. This needs a really good English speaker, someone who speaks a lot of English, interacts with people on a daily basis, and shows empathy to other people in English. Because
Let me twist it a little bit for you. Do you think that this struggle of yours that you had, because you struggled to go from Arabic to English and showing empathy.
yeah,
Now, there's moments in Kuwait where we have patients who don't necessarily speak English.
yeah.
Do you think that having that experience in Manchester made you better prepared here in Kuwait for those situations?
Yeah, well, to be honest, well, obviously Arabic is my first language, so
Yeah.
I didn't struggle with showing empathy in Arabic because
Mhm.
it's way easier. It's way easier to show empathy in Arabic. Like we all know the words. We all been speaking in Arabic every day, so we know how to show empathy in Arabic, and the words we use, like أجر وعافية الأمور طيبة إن شاء الله, like different things. You can use different phrases. But in English, to be honest, I personally don't know, except I'm sorry to hear that.
But what
That's
if you can't use English or Arabic?
You can't use English or Arabic.
Yeah, so let's say you have a patient who's come in here in Amiri or wherever,
Yeah.
and they don't speak Arabic or English. I once had an Italian woman
Yeah.
in Amiri, and she just kept speaking to me in Italian. I kept telling her I don't understand, and she just spoke more Italian.
Yeah, yeah.
So I mean, like in that
Yeah,
situation, how do you
yeah,
communicate?
I think showing empathy is not just in the words you choose,
Mm.
physically, your body language. It's more than one aspect of showing empathy. Like your tone also. Like you can't be shouting at the patient while showing empathy.
Mm.
Like your tone, ممكن their tone, your body language. So it's not just the words you use. But obviously for OSCE reasons, they want everything. They want your body language, your tone, the words you use, and you can't repeat the words. So
Now, circling to OSCEs and your clinical rotations, did you feel accepted in the hospital
yes, definitely. I felt very accepted,
by
very
patients
welcome
and staff?
by patients and staff.
Mm.
They're very welcoming, and I didn't have any bad experiences with anyone in the UK, whether it's a nurse or a staff or a secretary or a doctor or a medical student.
So that's definitely a pro of the UK then.
Yeah,
Yeah.
I think they're very fair there.
So geographically, maybe some cons, but at least on the other hand, you're not going to be struggling to work on the wards to interact with
No,
people, generally speaking. Fair?
No, it might be because we came from Manchester. We studied in Manchester. I think because Manchester has a lot of Asian students or students that look like us and speak the way we do. I think that might help, but I'm not sure about other students who are in, let's say, in Glasgow or in other places that the majority are white British people.
Mm. Now, do you know if students, like Kuwaiti students placed in other, like Glasgow, London, other cities, did they have the same geographical issues where their placements are not necessarily lined up with where they're living?
I think most of the universities are this way, because I know when I was in Preston, I met people in UCLan, which is a university in Preston. It has a medical school, and they were placed quite far, like 2 hours away from
2
Preston.
hours?
Yeah,
Wow.
yeah. So they struggled also with that.
Well, this is the way that the NHS works.
Yeah,
When you go to foundation year, you apply to a region.
yeah,
You don't
exactly.
necessarily apply to a specific hospital.
Yeah, exactly.
Now, what did you think of the NHS?
Well, the NHS, to be honest, first of all, it's very similar to the UK. The structure, how it's structured.
It's similar to where?
Kuwait, sorry.
Oh, okay.
The way it's structured, like you see there, we have primary care or GP, same way here, and then you get referred to the hospital. So in general, it's very similar, and both are free health care systems. But the NHS, I feel like, is very organized. I like the way it's organized, like where you have a 2-week referral rule, where they work exactly with the 2-week referral, and everything is very organized. Yeah, and I think they always complain of shortage, but I think we have shortage here in Kuwait, not there.
What do you mean?
Like I think if you go there, you hear the doctors in the UK, they complain of being understaffed
Yeah.
or there is shortage. But I think their ratio to patients is better than ours here in Kuwait.
Really?
Yeah.
That's really interesting. I was under the opposite impression.
Yeah. Well, to be honest, I feel like here we're understaffed. I believe we're
Interesting.
understaffed.
Interesting.
Yeah.
In across the board, like nurses, doctors, everything, or just doctors?
I believe mostly nursing staff.
Nursing staff.
Yeah. I think the ratio nursing to patients in Kuwait is not the best.
Yeah, definitely. I agree, and it does impact our practice.
Yeah, it does. It does.
Good nursing care is something that is so essential. You know, studies have shown that nursing care is more essential to patient outcomes than doctor care.
It does. It does make sense because they have most of the interaction with the patient.
True.
Yeah.
I mean, that's definitely a plus of the NHS in terms of nursing. Honestly, a shout out to them because they are really good nurses.
Yeah.
Really, really good nurses. Now, would you, on the whole, say that the NHS is better or worse than Kuwait?
Well, it's not a fair comparison, to be honest. You know why? Because UK is way older than us. It's been a country for so long, and we're a new country. We've been around from compared to the UK, obviously. So their system and they're used to having administrations and dealing with the big communities and populations. So I think they're better in organization. We could improve our organization here, like the whole administration and how things flow.
I'd agree, definitely. And I've actually heard somewhere, I don't know where exactly, so don't quote me on this. And if for any of our viewers out there, if I'm correct or incorrect, please do comment and or send us a text, a DM or something to comment on this. But I believe Kuwait's medical system was based upon in its foundation based upon the NHS. Yeah.
To be honest, it makes sense because if you remember how things are in the NHS, they're very similar to here in the UK. They're very similar, and I think it's quite similar. We have the same like pathway into a clinic. Like how do you get to a specialty clinic as a patient? There's the same pathway in UK and the US.
And I actually just realized we never said what NHS stands for. National Health Service. Yeah. For anyone listening and you're a bit confused, it's the healthcare system of the UK.
Yeah, it's basically the public healthcare system of the UK.
Now, how do you feel about the current state of the NHS? Because I think the NHS on paper is very excellent and amazing. Yeah. But how do you feel about the current state? Because it's something that I think we should bear in mind, especially if someone wants to go and specialize there right now, because they're going to work that system.
Yeah. I just want to go back to your question, difference between, you mentioned Kuwait. I think we have really good doctors, like extremely good doctors. So the people like here are very good. It's just the administration, the organization, how things flow. Like the fact that we're still in some wards, we're using papers. I think some that's
electronic and it's all mixed.
Yeah, I think that's a downfall, or things get lost easily. Yeah.
So the main advantage of the NHS would be the administrative.
Yeah, that's basically, I believe that. But with regards to members of both sides, Kuwait and there, I think we have very good doctors.
But now, would you say all of this still stays true? Going back to my next question is the current state of the NHS. Do you think this is true for the current state of the NHS, what we're talking about?
Well, from what I saw, because I didn't try another healthcare system, I will try the NHS. From what I saw, I think it's working well. It's working well. They're giving patient care. Maybe they feel understaffed with regards to doctors, which makes sense. They are understaffed. I won't deny that, but not as understaffed as other places in the world. So the state now of the NHS, maybe the salaries or the wages.
Yeah, they're voting on striking very soon.
Yeah. Well, I think for what they do, I think they're not being paid enough.
Yeah. Well, I mean, about the NHS right now, I think we should definitely bear in mind for anyone who wants to go and specialize there, because they recently opened the board with Kim's, right?
Yeah.
I think they should definitely bear in mind that there is right now a bit of a fight going on between the NHS and kind of the government or I mean workers and the government, in the sense that they're trying to reform things.
Yeah.
This is not exactly cruise control time. Things are not at their baseline right now in the NHS.
Yeah. It's not as stable as when we were there, because in general the UK, like every sector of the UK is going on a strike now.
Yeah, that's
Yeah,
true. I mean,
so-
COVID really came and shattered everything for
Yeah.
everyone. So it's definitely a shame, but
Yeah.
what can you do? Do you think your experience in the NHS made you a better doctor?
Yes, especially when it comes to work ethics, punctuality. Like I'm really amazed with how punctual they are there. Like when they say
So Kuwaitis are not as punctual.
like it depends on yourself, but I am talking about myself. Like if you give me time not to arrive, like if you tell me 8 to 8:30, I'll arrive at 8:30. But for them, they're very good with that.
I had a friend of mine the other day. We were meeting for coffee, and they told me, right. So I think it was like 5:30. They were like, okay, 5:30 British time or Kuwaiti time.
Well, exactly.
And then I said British time, and I was late. So
Yeah. I think it did make me a better doctor with regards to the work ethics and being punctual and like in general patient care. Like they really care about their patients there.
yeah, and it definitely shows in the way that they carry themselves. And the nice thing that I appreciate about the UK is that the way that people work there, it's not about the money.
Yes, exactly.
It's never about the money.
Exactly. Like even if let's say they finish at 5. Also something for you guys to know that their working hours there are way longer than Kuwait.
That's actually really important to remember.
Yeah, it's so you need to put that in perspective when you go there, especially whether you're going for a specialty or you're going as a medical student. We usually work from 8 or 9 till 5 p.m.
Yeah.
So they're even if they're done at 5, some of them stay till 6 or 7 just to complete their jobs. Yeah.
That was one of the things that I remember when deciding whether I should come back to Kuwait for my first year of training. Now the rules have changed, so everyone who's listening, like, you need to double check with KIMS if that's allowed for you to do foundation year there, which is our trainee year.
Yeah.
But I was exploring my options. Should I do my first year there? Should I do my first year here? One of the things I did have to bear in mind was thinking, right, so I want to specialize abroad, and those need exams. There's not a lot of time when you're working there to be studying for those exams.
Yeah, you don't, especially with their on-calls. Their on-calls are longer than here.
Really?
Yes.
I didn't know that.
I remember I asked one of the doctors, like I'm on my 30th hour or something like that. So it's definitely longer than here.
But they do give you, after nights, they do give you the time off.
Yes.
The day
which
off.
I think is very reasonable.
Yes.
Like after handover, every doctor should be able to go back home.
One thing I also do like about the NHS, the way that things work there is a better work-life separation. People don't take their patients home with them.
Yes.
You know?
Yes, exactly. Well, let's. I think what you said is right.
Hey.
I don't want to dwell on that. I don't want to dwell on that.
Okay. Then you don't want to dwell on it, huh?
Yeah.
Let's dwell on it a bit. So, Dr. Maryam Al-Fahd, she mentioned that this is a good thing that we take patients home because it improves outcomes. My personal opinion is that I think that if there's better organization, that's not a necessity.
Yes.
I think maybe the way things are right now, that is a necessity, but I think with some infrastructural change, that might not be a necessity.
Exactly. Like after all, doctors are humans. We also have separate lives at home.
Exactly.
And we have plans with people, things we want to do. There should be time. Once you're done from your job, no one should call you. You're done, unless you're on call, obviously. But otherwise, you shouldn't be taking your work life into your home, and then vice versa, your home life into your work. I think there should be separation, or it will start affecting your mental health.
I definitely agree, and we talked about that in Dr. Ghanim Al-Hashash's interview about wellness, because you do need that separation, otherwise you do lose it a bit. Drawing the subject back to the UK, we said in the beginning, who should do it? You said that it's not for everybody. Can you expand on that for me?
Well, first of all, it depends on what you're going to do. I'm talking specifically here about medical students. If you're going there to become a doctor, um, you need to understand. Like some people will be like before going, they'll be like, "Is it tough or is it not?" All medical students or all medical schools are tough, but you also need to look at the city you're going to, because the majority of your time is not in the university. To be around people and around places you're going to. So you need to choose wisely the city you're going to, not just university, because that will affect your mental health a lot. You need to find some time to go out and like live your life apart from just studying. And with regards to personality wise, I think you need to be someone who's able to stay away for long periods of time from family and friends. It's not easy. It's not easy.
No, definitely not. Definitely not.
You're not there on a vacation or a holiday. It's not 2 weeks or 1 month. It can go on for a year or 6 months. It will start affecting you.
Now, one thing in going to the UK is the weather.
Yes.
Who do you think? This sounds trivial, but really it did affect me. Which people do you think should avoid the UK based solely off the weather?
Well, basically, if you don't like rain, I think I know here Kuwaitis will be like, yeah, no, we do like rain, and it's quite.
You don't
No,
like rain.
there it's too much.
Yeah.
It's too much. Like you wake up every morning, you don't even think whether should I wear a jacket or not. No, you should wear a jacket, and it's most likely raining. So I think it's depressing because you can't walk around. Most of the time, like you'll be drenched in water. So
Yeah, I got used to having my socks wet.
yeah,
This was one
exactly.
experience for me, is that I just kept having my socks wet the whole time because just raining 24/7.
Yeah,
And for me, the sunshine also, I remember going into lectures, what was it, like in the morning, and the sun wasn't even out. It would just be cloud, but it wasn't pitch black.
yeah.
You go in for lectures for 4 hours, you come out pitch black.
Yeah. And that's also true during winter times, the sunrise and sunset time. You'd go in at night, not night, but it will be there is no sun or night time. Still there is before sunrise, and then you'd leave after sunset.
Yeah, and for some people, this is essential to their mental health and the things that they want to do. A lot of people, seasonal affective disorder is a serious thing, and it affects a lot of people. And I'd say the high majority of the Kuwaiti students that were with me described having some degree of seasonal affective disorder, in the sense that at the very least their mood was changing during the winter times in the UK.
Yeah, it definitely does, especially that when it's too cold to go outside and then it's raining at the same time. So it's two things that will not allow you to go outside, or it will be struggle to go outside unless you just go for just to eat or take out or whatever and then go back to your place.
Now, for students, what student would you recommend, you think they should be going abroad?
First of all, if you get a choice whether to stay in Kuwait or go outside, I always believe staying is better.
Really?
Yes.
That's interesting.
In general, I believe it's better. Because abroad, you will get somewhat, like, let's be honest, I don't think there's a difference in knowledge-wise you'll gain, whether in Kuwait or abroad.
Yeah.
The only difference is probably the skills, the clinical skills. There you're more exposed, you're more encouraged to do mistakes. Like they encourage you to try, like let's say venipuncture on patients, and obviously under supervision, and you're encouraged to make mistakes. I think that's...
So they don't want you to just go and stab patients, huh?
Yeah, you don't want to do that. Yeah, so if you get to choose whether to go abroad or not, in general, I believe Kuwait is better because, first of all, you don't have to worry about things, like minor things around you. Like, for example, paying rent and doing stuff, your electricity, doing laundry and stuff like that. In Kuwait, you're just focused on your studies. Abroad, you need to focus on other things that might affect your studying.
But who do you think should be going abroad then? Because there's plenty of students that are going abroad.
Yeah. People who are students who are able to independently live. Like if you feel like you can independently live abroad and do not need anyone, I think that's good. But at the same time, you need to be able to have you need to be good at socializing, because you can't live alone for 6 years. You need to be able to socialize, make friends, or go as a group of friends. I think it does help you. I went to the UK with a group of friends, so I knew people around me, because after, you know that, Aziz, after maybe the first or second year, you don't have time to make friends.
No, you
It's
don't.
either
You really
you
don't.
have your friends from the beginning, or
And
that's it.
maybe the hospital group you're with.
Yes, because
That's it.
and it's essential for you to have people around you that encourage you and push you, because it's not all days will be happy days and you're in the mood, and so you will have bad times, and in the bad times you will need people around you, especially family and good friends who will push you forward.
I definitely agree. And so what I'm getting the vibe from here is that the decision about as a student to go and study abroad is more based on your social skills and
Yes.
your personal circumstances rather than maybe knowledge.
No, I don't think knowledge makes a difference. Let's say your knowledge is not the best, you still have time to make it better. You have all the resources to be a better student. I don't think it has anything to do with knowledge. All of us are able to make ourselves better when it comes to knowledge or grades or scores or whatever. So I don't think it has to do with your skills or whatever.
And what's the benefit for you? Like, what did you gain going and studying abroad versus staying here?
To be honest, I personally feel a difference in my clinical skills and my exposure in the UK than people who came from other places.
Right.
So I think it helped me a lot. My confidence, my work ethics, being on time, my view on care of patients. Because let's say, throughout the years, you've been systemized in a way where you don't take care of patients. Obviously, that will be your result. The end product will be a doctor who is not taking care of his patients.
That makes sense.
It did give us resources. It teaches you how to, like from the UK, I learned how to do some research. It does give you the skills and the resources to improve yourself. It doesn't give you. It doesn't spoon feed you.
And overall, do you regret it?
No, definitely not.
Great.
But if time goes back, I don't think I would go, because I didn't feel a difference in general, in the bigger picture. Yeah.
So that's I appreciate the honest feedback there and the advice. This is the kind of thought process that people need to see, and I feel like I wish I had more of this thoughts. I was able to engage in this more before going abroad.
Yeah. But also maybe because I experienced the UK, so the UK might not be the best place to study. I believe that in the US it's better weather, better.
True.
I think the US might be better. I think the weather had a lot of impact on the way we view things.
100%. 100%.
And the working hours were quite long. So, but it's something very important students need to realize. Don't be like, I don't need anyone, I'll just go focus on my... No, you do need people there. It's
Human
6
beings
years.
are social by nature.
Yeah.
You're not alone in this world.
Yeah, so I had a really quite good, like a big group of friends, and I had relatives there. So I used to spend a lot, I don't think I stayed a week in Preston. Most of my weekends were in Manchester. I had my friends there, and I also had my friends in Leeds. So you need to be around people. You need to be away from your workplace or your study place.
Now, the last thing that I want to touch up on here is that you're a trainee. You're thinking about specialty training, right?
Yeah.
I think it'd be useful as a thought exercise. What are the thoughts running through your head right now in deciding whether you want to go to the UK to apply there for specialty training? What is kind of your pros and cons list? What's running through your mind?
Well, the pros, obviously, that you'll get good training.
Yeah.
Their training programs are good. The cons, I think I'm pretty sure it's longer than most places, the specialty there.
Fairly sure too,
Yeah, and also the working hours, I need to put that in perspective. Like if you're someone who likes to do some research or publish papers, I think in Kuwait you have way more time.
Or start podcasts.
Or start or a side business.
Yeah.
You have more time here in Kuwait. You need to think about working hours. You need to think about the environment you'll be working in. Are you a person who likes to socialize with other non-Kuwaitis? Because as a doctor there, you'll rarely find Kuwaitis, not as much as a student. as a student, because it's a huge community. We're like maybe 700 students there, as in general, like engineering and other majors. So you need to think about the work environment. You need to think about the weather is important. You need to think about what do you want to do. Do you want to do some research-based things and on the side? I think you need more you need more time of work.
Do you think maybe doing a rotation there, like a clinical elective or something, would help with exposing
I definitely
someone?
recommend every single person to do a rotation or an elective somewhere abroad. I definitely recommend it. I feel like it should be essential to every doctor who didn't try to work abroad or did anything abroad should try either in the UK or the US or Canada or wherever.
I definitely agree, but sadly for us with COVID, I remember I had my elective. I was sorted. I was going to go to the States, and that got axed because of COVID.
Yeah,
sadly.
well,
Yeah.
COVID ruined a lot of things. So. Yeah.
It's good that we're out. Yeah. Perfect. I mean, that's pretty much everything that I wanted to ask. This has been extremely, extremely helpful.
Yeah.
I think we've opened up your brain a little bit, and I'm hoping that everyone can engage in your thought process as well, and avoid making a mistake or the exact opposite. Be inspired and go.
Yeah.
If this is what you want.
Well, to be honest, as you said, but also people who are thinking of going abroad need to think that I'm talking from personal experience.
Yeah.
Or I might be biased.
True.
But
True.
it's not a mistake, definitely. I do recommend going abroad, but you need to think about every aspect of going abroad. It's not just the university. There is things other than the university. You need to think about the city. You need to think about the group of friends you're going with. You need to think about your way
Consider
of living.
the life outside the hospital.
Yes.
It's not just the hospital or the university that you're going to.
Exactly. The majority of your time won't be in the hospital. So you need to put that in perspective.
That's perfect. Thank you so much for coming on.
Thank you for your invite, and I hope it was helpful for everyone.
I'm 1,000% sure that it was.
Thank you.
Now that's the last sip of coffee for the day, everyone. A final special thank you to our guest. And tune in again next week for another episode. Episodes every Sunday. That's a wrap. Hope you all enjoyed this episode of The Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.